that if you look on Blackboard, there's a list of the muscles you need to know. Okay? So that, do you need to know every muscle that connects one vertebrae to the next?
Yes.
You just need to know this list here. This is the list.
Well, okay, that makes me feel a little bit better.
Yeah, so this is like a gift I've just given you.
Thank you.
No, you have it at home.
You put it yourself.
Now, today we're going to focus on some of the axial muscles, some of the muscles that line the axial skeleton. And then later we'll talk about the muscles of the upper and lower extremities. But we're going to begin with the muscles of facial expression. Now, most skeletal muscles, they originate and insert upon bone. The muscles of facial expression are not quite like that. Some of them have some attachments to bone, but many times they will insert into soft tissue or skin. And so, as far as having a precise origin and insertion, many of them don't have that. So your focus is going to be more on function and, of course, innervation. Okay? But as we go from one skeletal muscle to another, that's your focus on, is origin, insertion, function, and innervation. And by simply listening to me talk, you'll know what I think is important. Okay, I'll focus on those things that are important. Now, the nice thing about the muscles of facial expression is that they all receive the same innervation, which is what?
Facial nerve.
Facial nerve, yeah. So, whether I'm asking about the orbicularis oculi, or the occipital frontalis, or the orbicularis oris, or the zygomaticus, it's all going to be the same answer with regard to innervation. Cranial nerve 7, the facial nerve. Now, the first one we're going to talk about is the occipitofrontalis. Now, the occipitofrontalis is this muscle that extends all the way from the occipital part of the skull to the frontal region. It's actually a bipartite muscle. Bipartite means that it has two components. It's actually made up of two individual muscles that are joined by an aponeurosis. The two individual muscles are the occipitalis here and the frontalis. They're joined by this sheet of dense regular connective tissue, which is called the epicranial aponeurosis. So that on a practical, if I ask you to identify this muscle here, you can either identify it as the frontalis, or if you choose, you can identify it as the occipitofrontalis, making it part of a larger structure. That's fine. Now, sometimes in textbooks, they'll refer to it, instead of the occipitofrontalis, as the epicranius. I don't like that. Epicranius, but simply be familiar that that's an alternative name. Okay. Now, as far as the occipitofrontalis goes, it originates from the occipital part of the skull. And if you just look at it, that's easy to figure out. Okay? Now, the occipital component inserts upon the epicranial aponeurosis. So origin and insertion. With regard to the frontalis muscle, it's going to originate from the epicranial aponeurosis, and it's going to insert upon the skin and soft tissue around the eyebrows. So, when you contract this muscle, it's going to lift up the eyebrows. It's going to pull the scalp posteriorly, and in doing so, it's going to wrinkle your forehead. I want everybody right now to contract your occipital frontalis. That's it. That's it. A little bit slow on the draw, but good. Better late than never. Yeah. So that this is one of those muscles of facial expression, because if you want to look surprised, what do? Yeah. You kind of contract that muscle. It pulls the scalp backwards, and in doing so, it contracts the frontalis frontalis. It wrinkles the forehead.
Or if you want to judge someone, like,
Yeah. Yeah, there are subtle differences. Remember that the facial muscles have small motor units. And so when you contract different facial muscles in coordination, you can create different expressions, okay, that sometimes can indicate judgment or emotion, That's the wonderful thing about the muscles of facial expression. Now, if I were to ask a question like, well, what is the innervation to the occipital frontalis? What would you say? Facial nerve, yeah, this would be easy breezy. Facial nerve. Remember, the facial nerve comes through the parotid gland and does this. Okay, it forms lots of branches, about 5 different branches that provide innervation to these muscles. Now, let's look at this one here. What is this one called?
Orbicularis oculi.
Orbicularis oculi. It's a sphincter muscle. By definition, a sphincter muscle is a muscle that surrounds an opening. And when it contracts, it closes that opening. Okay. Now, the orbicularis oculi originates from the bone that surrounds the orbit, primarily the frontal bone and the maxilla below, and inserts into the skin and soft tissue of the lids, so that when it contracts, it closes the eye. That makes sense. So if you want to blink, like people used to blink a lot more than they do nowadays. Back in the day, you want to say hello to somebody, you do something like this. Particularly if you liked them, you do that. Or if you were interested in some other party within the class. For instance, let's say Alex had a sudden liking for Chris. What would you do? Can you do it? Yeah, how would you do it?
Wink at him.
That's it. That's exactly it. And now, do you see winking used like that anymore?
No, because it really sends a signal now.
What signal does it send?
Well, my mom did it at a museum, and a guy came up to it and was like, hey.
Right, well, yeah, and it's meant to convey that.
Yeah.
So what in the heck was your mom doing winking at somebody?
That's how she says hello, like, hello,
right.
how you doing? It's a
I
nice
see.
reaction. And
So
he
it
took
was-
it as, like,
He got the wrong
like,
message.
asking for a number and
Right.
everything. So,
But the orbicularis oculi is part of what brainstem reflex?
wait, what?
What brainstem reflex would this be a muscle? Would this muscle be a part of? Well, it's innervated by 7, but it would be part of the corneal reflex.
Oh, of the
Remember where you touch the cornea and it
So that's
triggers?
ophthalmic
Five.
vision.
One.
Obstructive.
Ophthalmic division.
Well, yeah, the sensory limb of that reflex is carried by the ophthalmic division of 5. The motor limb by 7, and it causes the orbicularis oculi to contract. Okay. Now, we talked about the zygomaticus major and minor. Again, these muscles of facial expression are relatively easy in that the zygomaticus, the name tells you its origin. What bone do you think it originates from? The zygomatic bone. And look here, it inserts into the skin and soft tissue along the corner of the mouth. In fact, it inserts around that orbicularis oris here. Okay. Let's see what your book says. Some of this is just common sense, by the way. You can read it in the book, but you can just look at the picture, and if you kind of know the picture, then it's fairly easy. Let's see where it says zygomaticus. Zygomatic bone is the origin. Insertion, skin and muscle at the corner of the mouth. Well, that's obvious when you look. And it's going to raise the corners of the mouth as doing what? What type of activity? Smiling. It's your smiling muscle. Yeah, that's what I like to see. Now, it not only draws a smile, but it accentuates. What are these structures called? The nasolabial folds. Yes. So if there's a weakness of the zygomaticus, then you'll have attenuation of that nasolabial fold. And then if I were to ask a crazy question like, what nerve innervates the zygomaticus major and minor? Facial. Now, remember that the minor is medial to the major. Don't confuse the two. Some people do. Some people do. Now, this muscle that surrounds the mouth. Okay, it's a sphincter muscle as well. So it orbits the mouth. What's its name going to be? Orbicularis oris. Yeah. So it's going to arise predominantly, if it surrounds the mouth, its fibers are going to rise from the mandible and the maxilla. Right? Let's see what the book says for this. Orbicularis oris. Yeah, maxilla and mandible. Well, that's obvious when you just look at it. Okay, and it's going to encircle the mouth, and it's going to insert into the muscle and skin at the angles of the mouth. Now, this is going to be very important for all young people, the orbicularis oris, because it's used for what? Kissing. Kissing. It's the kissing muscle. And probably more so than kissing, it's used now in selfies quite a bit.
The duck face.
When you do the duck face and you pucker. Right. How many people have done that in a selfie here? Just be honest. Keep it real.
Yo, come on.
Okay. So everyone here has done the duck face. Even you, Christopher.
For sure.
Do you feel a little bit self-conscious when you do it?
Not at all.
Not at all? Okay, I like that. You're very bold.
was saying you doing it.
What's that?
Wait,
So, yeah.
Chrissy do it too?
Yeah.
Yeah, Kristen.
Oh. Okay.
Now, I'm a little surprised at you.
That was middle school, so.
Okay.
Yeah.
That's
I know,
not
that's all
not
I'm
a-
saying. Like,
Brittany? Oh, wow.
oh, I know.
My son does it with me.
Oh, okay.
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 Oh.
So again, orbicularis oris, innervation, facial nerve. Now let's get a model of a head. Let's see. Yeah, let's get some of these people. Not so much tiny. Tiny, we have a hard time seeing tiny small. Maybe these two. Yeah, let's get this one here. Yeah, let's get this one here.
Really, Kat? Tiny is tiny. Here's multiple.
Hold on one second there. How much she does.
Yeah, no turn call.
You know, people say that. How many times have you ever seen someone trip over shoes?
No, actually, I did, because I'm just
I
that
feel that.
person. You remember you say not to be that person?
Right.
I'm always that
That's
person.
you.
Yes.
Okay. Let's look closely here. Zygomaticus major, zygomaticus minor, and then there's a muscle here that sits right next to the zygomatic muscles. Okay? It's directed downward from the orbit. It's originating in part from the zygomatic, partly from the maxilla, but it's inserting upon the upper lip. And when it contracts, it's going to raise the upper lip. Like you ever see a dog snarl and lift its upper lip? Now, this is called the levator labii superiorlis. You remember when we talked about the muscle of the upper lid? We called it the levator palpebris superioris. Well, this is also a levator. It elevates, but instead of the eyelid, the lip. And the term for lip is labii, Labii. So levator labii superioris, meaning the upper lip. Okay? And then on the other side down here, for the lower lip, you see this muscle coming up toward the lip, the lower lip? That's the depressor labii inferioralis. So a depressor instead of levator labii, instead of superioralis, inferioralis. Okay? Of course, it's going to arise from the mandible, because that's where it's located, and insert upon the lower lip. It will allow you to pout. Yeah, to pout.
And that's the depressor labii?
Superioralis.
Okay.
Was it superioris or inferioris?
Yeah. Yeah, inferior.
Inferioralis.
Okay.
If it's coming from below, it's inferior. We were close friends with another family growing up, and the dad was a great guy. His name was Mr. Tony, but when Mr. Tony would get mad, he would do this. You know, he would tense his lips like this, and it'd be pulled laterally. And I still remember that, and Mr. Great guy, but I remember that was his expression that he's unhappy with you. And risorius is the muscle that tenses the lips, that pulls the corners of the mouth laterally. Risorius. It arises from the soft tissue over the masseter and inserts upon the corner of the mouth, but it pulls the mouth laterally on each side, so it tenses. Okay, and again, facial nerve. So most of these, and so this would be the risorius, right here. This would be the depressor labii inferiorlis, right here. Okay. This would be the levator labii superioralis. It's just medial to the zygomaticus minor, which is medial to the zygomaticus major. Now, you're familiar with the masseter already. You know that the masseter is one of the muscles of mastication. It arises from the zygomatic arch and inserts upon the ramus and the angle of the mandible. The reason I'm bringing this one up now, this is not a muscle of facial expression, but for the masseter, its fibers run downward like this. Okay. The reason I'm bringing this one up is that there is a muscle that runs just inside, deep to the masseter. Now the masseter has been removed here, but this is that muscle. Its fibers run horizontally. Okay. This is called the buccinator. Buccinator. It arises from the molar aspect of the maxilla and the mandible. Okay, and it inserts around the orbicularis oris.
You said it runs horizontally?
It runs horizontally. In fact, one claim to fame for the buccinator is that the parotid duct pierces it. It travels right through it to reach the second upper molar. But if the masseter was included in this model, you would see it running superficial to the buccinator. And you'd only see a very tiny part of the buccinator. Okay. Now, we like to say that the buccinator blows or sucks, okay? Because it's involved in those functions. It's the trumpeter's muscle. When you tense that muscle, it keeps the cheeks taut, okay, so you can blow air out. By the same token, when an infant sucks, they tense that muscle to draw in milk. So it's used for blowing and sucking. Okay. Anybody here played a musical instrument with their mouth? Okay. What instrument?
Flute.
Flute? Clarinet. So when you're forming that embouchure, you're tensing. Now, it's also used, by the way, when you eat. When you're chewing, you're tensing the buccinator to keep food positioned between the teeth, so it doesn't get caught up between the cheek and the gum line. Okay? So main sound fucus is called the trumpeter's muscle because it's used to blow. That sounds funny, doesn't it? All right. Now, the last muscle of facial expression that we'll talk about is my personal favorite, because I still remember it from gross anatomy, the second cadaverous, and being really impressed with it. It's very superficial, meaning it's just deep to the skin. It's called the platysma. Platysma. And it comes up from the region of the shoulders and anterior chest. In other words, it originates here from pectoralis muscle fascia. Fascia is just soft tissue over the pectoralis, and it comes up over the clavicle, along the neck, and it's arising over the mandible. Okay? But it's very, very superficial. Okay? And it's attaching to the margins of the mandible and the corner of the mouth. Okay? And when you contract it, here's what happens. Okay? You kind of tense the skin of the neck. So if you're a male and you're shaving, oftentimes you do that. Okay? But it also helps to lower the mandible. You want to open your mouth wide, say ah, ah. You're tensing this muscle. It pulls down on the mandible. So you can use it to tense the skin of the neck, to pull down on the mandible. Those are both functions. muscles of facial expression. Here's a cadaver. What I want to do now is simply point, and we're going to identify the muscle. Okay? Brittany, what is this muscle label number 3 here? Excellent work. Excellent work. Okay? Let's see. Alex, number 21. You know what this muscle is? All right. Zygomaticus major. That's correct. Okay? JJ, number 10 here. What is this? Use the think system. Just remove, your blocking.
Is it the one that like contributes to the nasolabial folds?
No, that would be the zygomaticus muscles. This one, look where it's coming here from the orbit and it's descending down upon the upper lip.
It's the one that the levator labii superior.
Superiorlis, right? That's exactly it. Okay.
It looks weird because you can't like quite see it. Like it looks weird because it looks like all caught up.
It's kind of triangular shaped.
Yeah. Where does it extend down to?
The upper lip.
Okay,
Down
so it
the
comes
upper
all the
lip.
way
So
down
it's going to
there.
raise that upper lip. In fact, the name tells you what it does.
Okay.
Levator means the lip.
All right.
Okay. Now, Hunter, this is going to be a little bit tougher one. What is this one that surrounds the mouth?
Orbicularis oris.
Very good.
Oris.
Excellent work. Orbicularis oris. What are you looking at Brittany for?
I'm just looking over there. It don't matter.
Okay. Let's see now. Cat Craig. What is this muscle number 11?
Mentalis.
What is it?
No. Buccinated?
Chris, can you help her?
Zygomaticus minor.
Zygomaticus minor, yes. Zygomaticus minor. All right. Let's start all over. Brittany, what is this muscle label number 23? You can do this. Think method.
What does it do? What does that one do?
What do you let's just look at it. It's coming down like this, and it looks like it's inserting on the mandible. I suspect it's coming down from the zygomatic arch. So that's its origin. It's inserting on the mandible, so I suspect it's going to pull up on the mandible like you would do maybe if you were to bite down.
Is that the one that's horizontal? From
Do these fibers, look closely at these fibers. Do they look horizontal?
Another way that you did this, but when you said that it's with biting down.
Right, so let's look.
That is
These fibers are vertical. These fibers here, associated with number 20, are horizontal. But these are vertical.
And you're still biting
So this would be the out. You want to help?
down.
It's the-
Say it. Masseter, that's it.
I thought you said that wasn't a facial.
It's not. It's not.
Oh, well, that's why I didn't say it.
Oh, you just have to let go. You have to remember with the think method, you just let go.
Oh,
All
I
right.
thought you said that
Just
that
let go.
wasn't a muscle.
Well,
Where's the muscle?
But because it's right next to it, we have to include it. Okay? Because I don't want you to confuse it with this one here.
Well, I knew
Okay.
it's massive was, but when you said that it's not a facial expression, muscle of facial
It's
expression.
it's not. So what muscle innervates the masseter?
What muscle?
Well, I'm sorry, what nerve?
The trigeminal.
Right. Which branch?
V3.
Yes. B3. So that's the mandibular division.
So wait, where's the buccinator?
Buccinator would be right here.
That's what I was gonna
Oh,
say.
see, yeah, that's
That's
what I
what I
thought it was.
But
And
I
then-
want you to see the relationship between the masseter and the buccinator. And the fact that in one case the fibers are horizontal. Yeah, because in a practical, people confuse these two all the time.
Because they
I
look,
thought we were
it's
just
the
naming
same,
facial
yeah.
expression muscle. That's why I didn't say that muscle.
We did, but I want to make sure you. Okay. Now,
You look the same to me.
Can you see the Rosorius in there?
you really don't see the rosorius here. you're picking up a little bit of this one here. Kat, I'm giving you a chance for redemption here. What is number 14?
The depressor areolis, the elite.
So, well, you're throwing it out of whack there, but it's the depressor labii inferioralis.
Yeah.
You can't just moderate.
Depressor labii inferiораlis.
How to say it.
Now, look here. Look, son of a gun. Look what we see. Chris, what is this? 28.
Sternocleidomastoid.
Sternocleidomastoids headed up to the mastoid process.
That's not a bone.
Now, do you see here, this is the parotid gland, and all of these are branches of the facial as it's emerging from the parotid. Now, she's giving us certain expressions here, okay? Like here, she looks really happy, okay? She looks really happy, and she's lifting her eyebrows. What muscle is responsible for this?
It's that frontalis, occipital frontalis.
Occipital frontalis. Now, look here, there's accentuation of the nasolabial folds. What muscles account for
It's
that?
with the
Zygomaticus, major and minor. That's right. Okay? So it's causing accentuation of the nasolabial folds at the same time it's lifting the corners of the mouth. Okay? Now, she's closing her eyes like she tasted something that was awful.
orbicularis oculi.
Orbicularis oculi, and then perhaps she's going in for a kiss here, it looks like.
That's
She maybe just tasted something bad, but then she saw her boyfriend maybe.
Is it the orbicularis
Oris. And then it looks like maybe she gave the kiss and said, ooh, I'm not sure about that.
It's that thing. The platysma.
Platysma. Platysma.
Oh, what? Wait. The answers are right there.
Well, but it doesn't
Yeah.
connect them with the number. We saw this gentleman before. We said this gentleman has 2 cranial nerve deficits. He's got a facial nerve deficit on the left, and we assume that it's lower motor neuron, though he's not being asked to close his eyes. If we were asked him to close his eyes and he couldn't close his eyes, then we would know for certain it's lower motor neuron 7. But in addition, you're right, Brittany, he's got an abducens deficit because he can't draw this eye laterally. It's deviated inward. So that's a problem with his abducens. So and the fact that he's got 6 and 7 tells us the lesion is likely in the brainstem where those 2 those nuclei are located right next to each other. This is a person that's very interesting here. We talked about this condition, I believe. Myasthenia gravis. That what happens is it tends to affect, it's affecting more than just her eyelids, it's affecting many of her muscles of facial expression. But what you can see is happening is her eyelids are beginning to droop. Okay? And then you notice that, particularly on the right side, more than the left, she's got some drooping of the face as well. Now, in the shot next to it, she's been given a medication. Okay? And it's a acetylcholinesterase inhibitor. It blocks the enzyme that breaks down acetylcholine so that more acetylcholine is available to bind to those muscles. And so, in fact, this is the way we make the diagnosis. The patient comes in with weakness, with ptosis, you give an injection of this medicine, neostigmine, it's an acetylcholinesterase inhibitor, and all of a sudden, all their muscles begin to work again. And she can lift up her lids, and she can smile now. She's a happy person. Myasthenia gravis. What does myasthenia mean? Muscle weakness. Gravis means what? Serious. A term for serious. Okay. Now, how do I know that this is the buccinator here?
It's going horizontal.
Going horizontally, plus we see the carotid duct perforating it. Okay? Now, here's that muscle here, the depressor labii inferiораlis. You see the orbicularis oris. You can see the levator labii inferiораlis. Zygomaticus minor, major. Okay? And then we're seeing some additional muscles, the muscles of mastication. Again, to remind you the masseter arises from the zygomatic arch and inserts upon the angle and part of the body of the mandible. Okay, this is involved in elevating the mandible, okay, which is involved in closure of the jaw. So when we eat, we use this muscle. This other muscle of mastication is called what? Temporalis. All books describe this as a fan-shaped muscle because it fans out. Its origin is the temporal bone. It inserts upon, and you can see it right here, the coronoid process of the mandible. Just like the masseter, it's going to lift the mandible so you can bite down. But it's also pulling from back here. So it's also going to retract. If we pull something back, the jaw back, that's called retraction. So it's going to elevate and retract the mandible. It's used in chewing.
I have a question. So when you feel your temples, are you feeling that muscle?
You're feeling contraction of the temporalis. So you're feeling the temples as a person bites down,
Okay.
and that's what you're doing. Now, here's another picture of the temporalis. This is with the zygomatic arch intact. If you resect it away, you see the attachment to the coronoid process. Here's the masseter. It's attached to the zygomatic arch. It originates there and inserts upon the mandible. All right, so again, for the muscles of mastication, the innervation is the mandibular division of the trigeminal nerve. Sternocleidomastoid. Sternocleidomastoid, the name tells you everything. It tells you that it originates from the sternum, from the manubrium. It originates from the clavicle, the medial third, and inserts upon the mastoid. Right? Remember that the sternocleidomastoid, its function is to turn the head to the opposite side. So if you turn your head, you can feel, if you turn your head to the left, you can feel your right sternocleidomastoid contracting. And then vice versa. What nerve provides innervation? Accessory, number 11. Now, I think we've mentioned before that when you contract both sternocleidomastoids together, it becomes the prayer muscle. You use it to bow down or to flex your head and neck. Okay? So you would also use it, ladies, to just say no. No, you would say it to say yes. I'm sorry. That would be a yes.
Wait.
All right. Or to nod. You know, but you know how when you nod like this? All right, that's sternocleidomastoid. But nowadays, what I notice when you greet people, and this is just a personal observation, when you pass them down the hallway, you might tell a student hello. They don't, nod like this. It's an up nod like this.
Yes.
Yeah. So who knows?
No.
They don't say no. They don't say anything. They don't say anything. They just like that.
You can nod.
It's like, no.
Yeah. But it's an upward movement.
Yeah.
It's not a downward.
Yeah, the older people do it like.
Right.
But we do it like, what's that?
Yeah. You kind of do an exaggerated fashion.
Well, yeah, because that's how we do.
When you say we, you mean you and me?
No,
Okay.
you're excluded.
Thank you.
You're welcome.
Now, some people have a very prominent sternocleidomastoid. Some people's are not quite as visible. Okay? But who here thinks they have a nice sternocleidomastoid? That was at one time it was considered an object of beauty. A nice, well-defined sternocleidomastoid. Yeah.
Oh, no.
Well, we're not going to go there yet, but I'm going to say something else about the sternocleidomastoid. Let's go back. In addition to its function in moving the head and neck, the sternocleidomastoid is an accessory muscle of inspiration. Accessory, and this is very important. Accessory muscle of inspiration. Now, during quiet breathing, we don't use the sternocleidomastoid. The two muscles that are used during quiet breathing are the diaphragm and the external intercostal muscles that run between ribs. So these muscles are used to expand the rib cage during quiet breathing. We're just sit down and breathing. If somebody has airway obstruction, and the best example of this would be a child with asthma, where the airways are narrowed, they undergo spasm. We would call this bronchoconstriction. Okay? That narrowing of the airways, so that bronchoconstriction, is going to interfere with airflow. And so for that child to move air efficiently, they have to incorporate additional muscles to expand the thorax. And one of those additional or accessory muscles that are used to pull air in, to expand the thorax, is the sternocleidomastoid. It's called an accessory muscle of inspiration. Now, when it's used as an accessory muscle of inspiration, the mastoid attachment becomes its origin. And during contraction, you pull up on the manubrium and you pull up on the clavicle to increase the height of the thorax, to make more room for the lungs to expand. Okay? So when it's used in this fashion, it's called an accessory muscle of inspiration. And its origin and insertion switch. Okay, in other words, this becomes the immovable part that moves with muscle contraction, becomes the clavicle and the sternum. Now, I'm just looking here. So hold on one second. Oh, yes. Okay, so I'm going to ask Kat Gray to come on up here. Kat Gray, can you take off your jacket? Because that kind of hides your sternocleidomastoid. I want you to be proud of your sternocleidomastoid. I want you to give a profile view to everyone. You can pick up your chin a little bit, okay? I want you to, let's see, turn your head a little. Okay, you see, right there, right there. Y'all see this?
Yep.
Can y'all see a sternocleidomastoid coming up like this?
Yep.
Now, what I want you to do is take a really deep breath and hold it. Do you see it now? Okay, and blow out. So you notice when she needs to take a really deep breath, what happens to that muscle? It contracts. It becomes more prominent. Again, deep. Wow! Clavicle, sternum. Okay? Look how prominent it becomes. That's when she's using it as an accessory muscle of inspiration. Thank you, Kat. Great.
You're welcome.
By the way, does anyone know what this muscle is coming way back here? Trapezius. That's the other muscle innervated by a lever.
Is that the one that makes you strong?
Yes. Exactly. Okay. Now, this number 14 is just the sternal tendon of the sternocleidomastoid. This person has a condition called torticollis. It says that it's caused by, it's associated with dystonia of the facial muscles. Oh, she says it's associated with some dystonia. Dystonia means abnormal tone or increased tone, but torticollis, what it really is spasm of the sternocleidomastoid, such that her left sternocleidomastoid, you can see, is undergoing spasm, and it's forcing her to turn her head in a certain direction, okay, like this. It can even be painful. Now, people who develop torticollis have a rough time of it. There was a 60 Minutes show one time that was devoted in part to a patient, a businessman with torticollis, who had lost his job because the employer didn't like the way he presented himself to potential clients. You know, when the spasm got bad, he was like this, and he just didn't think it presented a good image. For the patient themselves, the spasm can become painful. Up until maybe a decade ago, there wasn't very much good treatment. What we'd do is give muscle relaxants. In the old days, we'd give Valium, or a drug like Ativan, if y'all are familiar with and they do make you a little bit sleepy. Nowadays, we can inject the muscle with what?
just about to say.
No. Botox. Botox, and it causes the muscle to relax. And it's made a significant difference in people's lives.
Especially face.
Let me show you something here. Let's look at something.
What about when they do this? Like when people go like,
Oh, those are ticks. Yeah,
Those
the
are
Botox
ticks.
doesn't really help that.
no.
So how long, like, would they be normal and then it's just like,
Well, in the beginning, you have to inject them fairly frequently, but they get to a point where you can inject them like every 6 months.
so how would it happen? Would it be all the time or would they just be normal and then you just be like,
It depends on the severity, but it's usually a slow spasmodic type of contraction. It's not like this,
oh,
okay? But it's more increased tone and spasm.
so it slowly get like that?
Well, generally when it occurs, it can last for hours to days. And sometimes it can become part of their life, that it's happening most of the time. You remember that these nerve endings that serve skeletal muscles, that they participate in what we call the neuromuscular junction. And along the presynaptic part, you have these synaptic vesicles. They contain neurotransmitter that have to be released and then bind to receptors on the postsynaptic membrane. Well, the way Botox works, actually, is to inhibit fusion of the synaptic vesicle with the presynaptic membrane. It blocks that. Okay. So if what you're doing is blocking release of the neurotransmitter, of acetylcholine. So that if you can't release acetylcholine to bind to these postsynaptic receptors, the muscle can't contract. Okay. Remember, Botox is just a purified form of botulism toxin. It's a toxin released by a particular bacteria. So that's how we treat people with torticollis now.
It doesn't have any like long-term effect to where like on their body or anything like that?
You know, as long, you know, the key is to dose it correctly. Okay? Dose it correctly. Can you overdose Botox? Yeah, all of a sudden then a person can't move their part of their face, you know. So you want to give enough so that there is some movement, but not enough so that they're spasming. Right, so it's kind of titrating the dose. That's important. This just shows you, we said that the mandibular division of 5 is going to be what provides innervation for the masseter and the temporalis. But remember also the mandibular division provides sensory innervation part of the face. When we test the cranial nerves, we're really testing their function. So when we're testing cranial nerve 5, we're palpating over the temporalis as the patient is biting down. We feel the contraction. That tells us that that mandibular division of 5 is intact. We'll do the same thing over the masseters when we're testing 5. Remember, when we do a neurologic exam, part of that is the test of cranial nerves. And we'll go from 2 to 12. Here we're testing what cranial nerve?
Excessive. Wait.
Sternocleidomastoid. We're asking the person to turn their head against resistance. You know, and if they can keep that sternocleidomastoid contracted so we can't push their head back, it tells us that the accessory is intact. This is a nice view. I'll put this in here because it shows nicely the trigeminal nerve. That would be the ophthalmic division. What is that going to pass through? What opening?
Superior orbital fissure.
Superior orbital fissure. Here's the maxillary division, which is going to pass through what opening?
Ovale,
Rotundum.
rotundum.
Rotundum. And here's the mandibular division that's going to pass through the ovale. Okay? And one of these branches is going to do this. Become the inferior alveolar nerve. So where does that bring us? We've gone all the way down to sternocleidomastoid on your list. Okay? Now, next, the next muscle that's listed is the external intercostals. Let's get Red Fred's chest. Red Fred's chest is hiding somewhere here. Brittany, you hide it. Okay, thank you. Now, you're going to need to differentiate between the external and the internal intercostals. In general, the external intercostals are located more superficially compared to the internal intercostals, which are deeper. But there are some locations where the external intercostals don't cover the internal intercostals. Okay? So the way that you recognize the external intercostals is the direction of the fibers. They're running like this. It's as if you have your hands in your pockets. Okay? So the external, the fibers are running in this direction here. Okay? Whereas the internals, opposite. External, internal. The fibers in the internal, instead of running like this, they're running like this. Okay. So here would be internal intercostals. And you pick that up because of the fiber direction. Okay.
Wait,
Well,
internal ones like
external is running like this. And show me internal.
it's okay, crossing.
Now, both receive innervation from intercostal nerves. Okay, that's easy. I mentioned earlier that the external intercostals are involved in quiet respiration, specifically during inspiration. When we breathe, okay, what we do is expand the chest, which then in turn leads to expansion of the lungs. During quiet breathing, the two muscles we use are the external intercostals and the diaphragm. The external intercostals originate from the inferior margin of the upper rib and insert upon the lower rib, the upper margin of the lower rib. So, in other words, they move from upper to lower. When they contract, they pull up on the lower rib. And it's analogous to picking up the handle of a bucket. As you lift up that handle, as you lift up the rib, the surface area increases deep to it. So as we lift up the ribs of the thorax, the AP diameter of the thorax increases. The thorax gets bigger. Its volume increases, allowing the lungs to expand. Okay, so during quiet breathing, we're moving the diaphragm and we're moving the external intercostals. Now, inspiration is an active process. So quiet inspiration, just breathing as you're doing right now at rest, is an active process, meaning it requires energy. Okay? And that energy is used by the external intercostals and the diaphragm. It contracts muscles. Expiration is a passive process. Quiet expiration doesn't require any energy. We simply relax the diaphragm and the external intercostals. So if I ask you the function of the external intercostals, you would just say quiet inspiration. Same thing with the function of the diaphragm. Quiet inspiration. Okay. The next muscle that's listed is the diaphragm. I'm going to draw the abdomen like this. Okay. And let's say this represents the diaphragm. Above it would be the thoracic cavity. There's the abdominal cavity. Okay. The diaphragm is what separates the thorax from the abdomen. When the diaphragm contracts during inspiration, what it does is it moves down like this. Okay? So we're moving the diaphragm down, and that increases the height and volume of the thorax, allowing more room for the lungs to expand, full of air. All right? So During quiet breathing, quiet inspiration, we use the diaphragm to expand the volume of the thorax. So it allows more room for the lungs to pull in air. So again, the function of the diaphragm is quiet inspiration, just like the external intercostals. What is the innervation to the diaphragm? Phrenic nerves. Yeah, the phrenic nerves. We say 3, 4, and 5 keep the diaphragm alive. Now, I will not ask you the origin of the diaphragm. And the reason is because it originates from several different bones and structures all the way around the thorax. In other words, from ribs to vertebrae. Okay? It inserts upon what's called the central tendon of the diaphragm on either side. So let's see if I can find that picture of the diaphragm. So it's originating from bony structures around the thorax, but the fibers insert upon the central tendon on either side. And again, when the diaphragm contracts, it pushes downward into the abdominal cavity, which in turn expands the thoracic cavity. Now, question. Is the sternocleidomastoid used during quiet inspiration? No. It's an accessory muscle. It's only used during deep inspiration. We need to pull more air in. So, that brings us about halfway down that first page. Let's take a break, and we'll start again at 11 o'clock.
I know the video's still going.
Wait, let me get online.
What?
Let me get online.
Capital C. Well, I guess I don't.
Is that Katniss?
No, it's not cat.